My name is Dr. Sabrina Fabi. I'm a board-certified dermatologist practicing in Southern California. I'm in private practice at Cosmetic Laser Dermatology, and I'm also volunteer assistant clinical faculty at the University of California, San Diego. Ultherapy is the only FDA-cleared device that also has a CE mark for the treatment of non-invasive dermatological sculpting and lifting of the dermis in the upper face, lower face, neck, and décolleté.
My name is Vivian Bukai. I'm a board-certified dermatologist in practice since 1991. I live in San Antonio, Texas. My focus primarily right now is on that patient who wants to look their best. So whether you call it aesthetic dermatology or cosmetic dermatology, that's why I focus. In my practice, the patient who comes in asking for Ultherapy is typically somebody anywhere from their 30s to 60s with mild to moderate skin laxity. It's a patient who is a patient who's willing to wait to see results because collagen building, which is really at the heart of this treatment, is something that takes around 90 days.
Ultherapy is the only device that has an indication for real-time visualization with treatment. Because if we're treating bone, what are we really doing? If we're treating vessels, what are we really trying to accomplish? The point of this procedure is to deliver these thermal coagulation points at 65 degrees Celsius to denature collagen. If we're not treating a plane that has any collagen in it, then how could we ever expect a lift? So the visualization correlates directly with the ability to have a meaningful result.
Initially, when I started in practice, one of the first technologies I brought on was full-face carbon dioxide resurfacing. And great technology, but really we were treating on certain principles, but couldn't really see what we were treating. You know, we were just hoping that the tissue we were targeting was actually that tissue. So what was to me very attractive about the Ultherapy system is the ability to actually see the targeted tissue. I don't have to guess what layer of skin I'm in, whether I'm on muscle, whether there's a blood vessel or on bone, because the image is there for me.
Visualization is critical when we perform procedures like Ultherapy. No one would argue that it's not necessary with any aesthetic procedure we perform, like fillers for instance. We would never inject a filler with our eyes closed because we wouldn't know if we're injecting it into the dermis, into the subcutaneous fat, or into the periosteum, or in the right place for that matter. We need the same confidence when we're trying to target SMAS and platysma. We need to actually be able to visualize what we're targeting at real time so that we know that we're treating the tissue that's going to actually give us a lift.
So the nice thing is that when I'm doing treatment, I don't have to rely on navigating blindly. I have the image on the screen, in essence my blueprints, that allowed me to guide the treatment. The other fantastic thing about it is I can customize the treatment. It's the only system that visualizes in real time. So it's not that I have a photograph and I'm referring to that, I actually can see at all time where I'm treating.
So it's imperative then to be able to visualize the tissue that I'm treating, not only to give my patient a meaningful result by targeting the right tissue plane, but also to ensure that I'm not treating over a gel pocket and displacing that energy and placing it higher than it's intended to be, which can potentially compromise and burn my patient, but also because if I have too much air, I would never know it. And then I'm just firing energy into space and it's never even getting to the tissue to create a result. Ultherapy fits in because it's able to target those tissues to provide a meaningful lift that no other device can or has an indication to do.